hospital librarian with Intermountain Healthcare in Salt Lake City. And then I had 8 years as an associate librarian with the Eccles Health Sciences Library at the University of Utah, and 1.5 years as a research specialist with the Essentia Institute of Rural Health that's here in Duluth. So you've heard a little about me, and now I'd like to share just a few words about the network. So you're probably familiar with the acronyms on this slide, but maybe unsure of how they all relate to one another. NLM, the National Library of Medicine, is one of the 27 institutes and offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources like PubMed and Medline Plus. NNLM is the network of the National Library of Medicine, and it's an outreach program of NLM. And we do our work to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities for over 9,000 NNLM member organizations. Region 6 covers the Midwest, and it includes Iowa, Illinois, Indiana, Michigan, Minnesota, Wisconsin, and Ohio. So if you'd like to learn more about us, you can check out our website at nnlm.gov. So for today's session, got just a couple of informational items to cover. I'd like to ask that you hold any questions that you have on the content that I cover until the end of the session, and I've dedicated some time then for Q&A. Those of you who are not in that group room, you're joining us online, you're welcome to enter your questions and comments in the chat at any time. Just address your post to all participants. And I know I have Megan and Brittany that are providing some technical assistance online. I do have some troubles looking at the chat all the time when I'm sharing my slides. So they're going to help me queue up your questions and address them at the end. For the librarians that are joining us, there is one Medical Library Association continuing education credit that's available for this training. And Megan and I will coordinate sharing that, as well as an evaluation link with everyone who registered for this session after today. Your feedback really matters to us, and it helps us improve future training. So please take a moment to complete that evaluation for us. And here's the agenda for the next hour. We're going to begin with an overview of rural America, defining what it means to be rural. We're going to highlight current demographic trends and then discuss what impacts health in these communities. And then we're going to explore 5 resources through some live demonstrations, highlighting the different ways that you could use each of them to serve the health information needs of those that are living in rural areas. And then we're going to wrap up the session with some time to answer questions. All right, so I am just going to turn off my camera now, and we'll move into the class content. And I'm going to experiment here and see if we can get a little group discussion going. I really want to kick things off by hearing from you. What are the first things that come to mind when you think of rural? And those of you who are in the room in person, you can just start talking. And those of you who are joining online, you can type your thoughts into the chat and try to make sure that we share everything that's coming together here. I think we have something in chat. Farming communities. Yep, there's one thing.
Underserved.
Underserved, great. Okay.
Long EMS response times.
Long EMS response times.
All right. We're getting some specific healthcare services here. That's good.
Low population density.
Low population density. Yeah. What are some other things?
Lack of internet.
Yep. Lack of internet. Hard work. Yeah. Great.
Blue collar.
Blue collar.
Hospitals closing. closing hospitals,
Mm-hmm.
Minimal psychiatric resources.
minimal psychiatric resources,
Okay. We've got another comment online about multi-generational farming, multi-generational families living closer together. All right.
That's a term, like rooted, being really rooted in your community.
rooted in your community.
Mm-hmm. Great. We touched on a lot of these things that the tight-knit communities. Yeah. Then there's also the kind of the opposite end of that extreme where people are living in really remote and isolated areas. Sorry, I do see that there is one hand raised. I don't know if that was an additional comment about rural or if that's a technical issue for you.
Sorry, I think this is very interesting topic, rural. So recently I was looking how to define rural in terms of healthcare access. So, people were defining in terms of population density and in terms of access to healthcare things. That's what I wanted to share. Thank you.
Great. Thank you for adding that. Yeah, the population density. So yeah, people can either be grouped together in tighter knit communities or else really isolated and remote from one another. There are many different geographies and landscapes. There's areas of natural beauty. There's areas that people consider flyover space. There's different racial and ethnic profiles. Lots of different economies and job opportunities at hand. Somebody mentioned farming. There's also manufacturing plants, tourism, casinos on some of Indian reservations. There's ranching. And some of the rural areas include the most impoverished and the richest counties that are in the country. So they're definitely not one-dimensional. They're more complex and diverse than you might think at first. And with my personal experience, I grew up in Maine and Virginia, and then I've lived in Washington, Indiana, Utah, and now northern Minnesota as an adult. And I can attest that the rural areas in each of those states varies tremendously. So, given all this diversity, how do we define rural exactly? And it turns out that we don't. We have multiple definitions. Federal, state, and local agencies, as well as numerous data resources, define rural differently, with each one selecting the definition that best meets the needs of their programs. And being familiar with these various definitions is going to be really helpful. You'll be able to better understand what different statistics that you encounter mean, and it'll help bring consistency, accuracy, and validity to research and data collection that you might do. Also, being familiar with those definitions will help you determine your eligibility for various rural grant programs and help ensure that the programs that you design address the populations that you intend them to. So the three federal definitions that are in widest use are shown on this slide, and they come from the U.S. Census Bureau, the Office of Management and Budget, or OMB, and the United States Department of Agriculture Economic Research Service, which I'm going to refer to as ERS from here on out. So let's take a look at each of these different definitions. So it's interesting to note that all three agencies take the same approach when they're defining rural. They define what's urban first, and then rural is whatever is left over. But despite having this common approach, they have really different results when you're using their different definitions. An area that's classified as rural according to one definition may not be considered rural by another one. And this table highlights how those three primary federal definitions are different. Note that this U.S. rural population, the numbers that they're representing, the U.S. Census Bureau numbers comes from 2020 census data, but the OMB and the ERS numbers come from 2010 census data. And they are going to be updating their population figures later this year. But for right now, unfortunately, this is the comparison that I had at hand. So starting at the top there, the Census Bureau identifies areas at the census block and the block group level, and it defines urban as areas with at least 425 housing units per square mile, at least 2,000 housing units, or at least 5,000 people. So rural would be any area not meeting those numbers. And on the basis of that definition, approximately 25% of the US population lived in rural areas in 2020. The OMB's definition identifies areas at the county level, and they get classified as either metropolitan, with a population of at least 50,000, or micropolitan, with a population between 10,000 and 50,000. So any area not classified as metropolitan is considered rural, including those that are micropolitan and those that are smaller than the micro areas. So on the basis of that definition, approximately 15% of the US population lived in rural areas in 2010. Then the ERS collaborated with the Federal Office of Rural Health Policy to develop rural urban commuting areas, or RUCAs. Sometimes you'll see those codes referred to just as RUC. Using census data, they looked at population density, urbanization, and commuting. And then they classified areas along a scale of 1 through 10. And rural areas are those with RUCA codes of 4 and above. So on the basis of that definition, about 17% of the US population lived in rural areas in 2010. And I've got a really neat tool that I'm going to show you shortly that you can use to determine if an exact location is considered rural according to each of these definitions. But for right now, we're going to take a look at how these definitions are being used to understand demographic changes. So recent reports indicate rural communities are continuing to experience widespread population declines, and that's mainly as a result of outmigration of young adults. But at the same time that the overall population's been declining, there are two demographic populations that have increased. ERS data shows more than 20% of rural residents are now over 65, compared to just 16% in urban areas. And census data is also showing that racial diversity has been growing. And historically, rural areas across the country have had different racial and ethnic profiles, including Native American and African American populations. But the data from the 2020 census showed that rural areas became increasingly more racially and ethnically diverse over the past decade, and the largest growth has been among Latinx populations. As of 2020, 24% of rural Americans were people of color. The poverty rates have also been growing. This graph is an ERS report on rural poverty rates, and it shows that in 2019, rates were higher in rural areas than in urban areas across all races and ethnicities. So the blues representing the rural areas, yellow are metropolitan areas, and rural Black or African American residents had the highest incidence of poverty at 30.7%, and that was more than any other race and ethnicity group, whether rural or urban. Urban non-Hispanic white residents had the lowest poverty rate of all, and that was at 8.2%. So poverty is obviously one factor that can significantly impact health and health outcomes. And I just wanted to hear from you again about what some other things are. So in your experience and in your line of work, what impacts health in rural communities? Resources, yeah. Access to healthcare.
Lack of education.
Lack of education. Lack of providers. funding. Yeah.
Different attitude towards illness also.
That was a different attitude towards illness. Is that what I heard? Yeah.
Yes, some
Good.
populations actually make illness a badge of honor. Having some chronic illness is important to them.
Some observations that my research has revealed was the availability of resources for health and nutrition. So it's not just you don't have like the money to afford foods, but the resources that you have are not Kroger. They're the dollar store on the corner, and you get a convenient mart that doesn't want to invest in fruits and vegetables. Because that stuff expires quickly and they lose money. So you only have box cereals, canned goods, and those kind of things, nutrition support. And then the money that you do have often goes for investing in vices like smoking and so forth, because that might be only. But it has been reported even in pregnancy with women that they will find that the only vice they have is smoking. It's their outlet, deteriorate their health. And
Yeah.
other novelties like dental care, which companies.
I missed just some of the very last part of what you said there, but I did hear the parts about the type of grocery stores and food places that are available. And then, sorry, I did hear the rest. Now I'm forgetting the second part that you said there.
Second part was about vices that their only outlet, particular smoking.
Yes, okay.
Then,
Care is not-
yeah, and then dental care is not considered important.
Mm-hmm. Yes. And we had a couple more comments online about more sitting, driving than walking to get places. And home remedies and treatment also might be lack of insurance. No tertiary level healthcare facilities. Yeah, great. I think you hit on just about everything there. The health risk behaviors, the higher rates of smoking, obesity, alcohol and drug use, and then lower rates of physical activity and seatbelt use. Of course, there's the less access to healthcare services, whether that's with providers, including dentists and specialists, and then fewer facilities. We've had hospital closures, and we know that there are fewer ICUs to serve people, which we certainly was brought to light during the pandemic. We got the limited broadband service. I think that was mentioned in the first group discussion that we had. Broadband service is now being described as a super determinant of health. And I think Ohio, let's see, one of the estimates I saw, that was 2021, was that the number of households without an internet subscription was at 13.5%. Of course, there are higher rates for service for everybody that live in rural areas, and the infrastructure is just more expensive to set up. And now we're having that impact of the inequity of telehealth being able to be taken advantage of by rural residents. Got transportation issues. I don't know if we talked about that one. Costs are disproportionately higher for vehicles, and there's less transportation options, and you have to go longer distances to get to routine checkups and screenings. Environmental hazards. We've had a few things in the news, which weren't necessarily in the most rural areas of Ohio, but just emphasize that things can be happening like that to affect water quality. And then just with different occupations in rural areas, there's higher rates of certain types of cancer from exposure to vapor gas, dust, and fumes. And then you touched on the food insecurity. Yeah, fewer grocery options and lower availability of affordable, healthy foods. So all of these things that you've mentioned are reasons why people living in rural areas are recognized as a health disparity population. The prevalence of disease and the rate of premature death are higher in rural populations than for overall populations of the United States. So we're going to explore 5 resources now that can be used to help improve the lives of rural residents and helping advance health equity. And these resources provide access to consumer and health professional level information on health conditions, statistics on demographic groups and social issues, data sets and visualizations for downloading, and lots of tools and models for developing programming and policy. All right, so the first resource that we're going to look at is Medline Plus. And Medline Plus is the National Library of Medicine's consumer health portal. It offers current and reliable information on diseases and conditions, wellness issues, drugs and supplements, and medical tests. And it links to information from over 500 vetted organizations and offers content in multiple languages and at different literacy levels. There's no advertising on the website at all, and Medline Plus doesn't endorse any companies or products, and it's freely available to anyone. So I am going to leave the PowerPoint slide now and bring up Medline Plus, close that down. All right, so just right off the bat, I'm going to show you that the entire website is available in Spanish just by toggling over here on the right side. And then here you have all of the content available in Spanish. We can toggle right back to the English version. And Medline Plus has 5 main sections. You can see them in the tabs running across the top here: health topics, drugs and supplements, genetics, medical test, and medical encyclopedia. And you can also use these green tabs in the middle of the page to get to that same content. Here, I think just so it looks attractive, we have a 6th one, healthy recipes, that's added on. And then down here at the bottom, there are 2 collections that I'm going to highlight. This one that is a link to easy to read plain language health information. And then we've got another link here to a collection of health information that's in more than 50 languages. All right, so I'm going to go back up to the top and click on health topics. And the health topic pages are the largest and the most commonly used section of the website. This is a good place to start either for your own explanation or for when you're helping patients. This is where you can learn about wellness issues and the symptoms, causes, treatment, and prevention of over 1,000 diseases, illnesses, and various health conditions. And you can find the topic either through this alphabetical list or by looking under one of the categories below. So I'm interested in looking up some information on lung cancer. So I'll go over to the left under body locations and systems, go down the list and click on lungs and breathing. And then I'm going to scroll down the alphabetical list to L, and I'll click on lung cancer. So here's our health topics page. And these 2 boxes here at the top serve as your table of contents to the page. You see we've got information on prevention and risk factors, living with lung cancer. There are some videos and tutorials. And then we have some patient education information that's for different populations there. Scrolling down, we have a summary section. And then following that are where the links out to different information start. So this first one is for general information about non-small cell lung cancer. To the right of the hyperlink in the parentheses is the organization that's providing the information. So this is the National Cancer Institute. I'll show you what this resource looks like. Got links to different information, lots of illustrations. There's a video that's included in this one too. And all of this can be printed out. I'm going to close that pop-up window now. And then I'm going to scroll down to another section down here for finding an expert. So here we have a link for Find a Cancer Doctor. And this is from the American Society of Clinical Oncology. I'm going to click out to that. And I am going to look for oncologists in Piketon, Ohio. I'm going to change this. I want to see somebody within 25 miles of my home, preferably. Let's click apply. And we've got 2 providers that are within 25 miles for us there. So this site can also be used by librarians, researchers, and healthcare professionals to discover other NIH sites or health organizations that provide information or are involved in research awareness or patient support on a particular topic. Sorry for the fast scrolling there. I'm going to go back to the home page, and I'm just going to show you a different type of health topics page. I'm going to click on R. Scroll down to the bottom here and then bring up this rural health concerns page. So it's not just information on diseases and conditions here. You have some kind of topical content too. We've got a summary here. It highlights some of the challenges to living in rural areas that are some of the things we've just talked about. And then underneath the summary, we have links to our information. You'll notice in this case, a lot of these links are provided by Rural Health Information Hub, which is one of the resources that we're going to be taking a look at. We've also got a link here to journal articles in PubMed. This is a pre-formulated search. It's a live search, so it's constantly being updated with current content. And the whole search is up here in the box. So you could actually copy and paste this into PubMed on your own and start playing around with it to refine the search a little bit or change things to get nailed in on exactly the kind of content you're looking for. But this search is set up to receive only free full text articles. So you'll be able to get into all of the information here. All right, I'm going to go back to my PowerPoint slides now, and we'll bring up our second resource. This is another federal resource. This is ERS, as we mentioned, USDA Economic Research Service. ERS focuses on agriculture, food, the environment, and rural communities in the United States. And they track trends and emerging issues in these areas, and they conduct economic research to inform public and private decision-making. This is a site that librarians, healthcare professionals, and researchers can use to find rural data at the national, regional, state, and county levels, and find reports on rural economics, demographics, and environmental and social characteristics. And I'm going to click on this web page now. Looks like I've got to move my screen over. So here's our home page, and we've got these tabs running across the top that allow us to easily navigate to different types of content. Scrolling down, we have 3 columns across the page. On the left, we can get to reports, data, charts, and maps easily. The middle column has a link to Amber Waves, which is a monthly online magazine that shares ERS research and analysis. On the right, we have links to a couple of atlases and then to a growing collection of interactive data visualizations. Down towards the bottom, we can access recent reports and research that's been published. And then in the middle, we can check in on new release dates and events. So the easiest way to access all the content related to rural communities on this site is to click on the Topics tab and then click on Rural Economy and Population. And we can access content here by subject area. It's in the center of the screen. Or we can access things by type. We've got reports, Amber Wave articles, data, and topics. So under reports, we can pull up the latest Rural America at a glance. This is a report that's been published every year since 2003, and it provides an annual summary of demographic and economic trends, and it highlights current opportunities and challenges facing rural America. And I really like on this entire website, they do a lot of cross-referencing. So we've got some links here to related content, including webinars, topic pages, and publications. And the last few years, they've been publishing the new edition for this in November to correspond with National Rural Health Day. So you can keep an eye out for it then. Going to go back now, and under Amber Wave articles, you can see a list of recent articles pertaining to rural areas. We've got one here that's on insurance, and then another on impacts of COVID-19 on poor rural counties. Under data, I'll show you the county level data sets. So ERS compiles statistics on 4 indicators: poverty, population, unemployment and median household income, and education. I'm going to click on this 2020 poverty information. And this brings up a national map. I know it's a little skewed on the screen and a little small, but I hope you can see that okay. The darker colored states are the states with the higher rates of poverty. And the lighter colored states have lower rates. Scrolling down, we also have a table of the information. We can see on the row for national information, the rate for the whole country is at 11.9%. If we scroll up and hover over Ohio, we see that the poverty rate is 12.6%, so higher than the national average. And then I can click on Ohio, and this will bring up a county map now. And we can dive into the numbers at this level. And notice now we've got a column with root code. So as you might recall, anything 4 or higher is considered a rural area. So we can sort this data by rural versus urban and take a look at numbers that way. And we have the ability up here to download the data in a couple of different formats. Okay, go back one more time here. Oops, sorry, the mouse is not behaving well. There we go. All right, so also under data, we can take a look at the Atlas of Rural and Small Town America. This is a compilation of over 60 socioeconomic indicators and total population change trends for different demographic groups. Because this data comes from a variety of federal sources, the year and the geographic level of the indicators vary, but most of them are available at the county level. And you can click on documentation over here on the left-hand side and get the details on the different indicators, the data definitions, and the data sources that were used. Well, let's take a look at the actual atlas itself now. Click there. And you see we've got a national map, and this is already populated with the indicator population change rate, 2018 through 2019, but we can change what indicator we want to display. So under people, I am going to scroll down the list here, and I'm interested in looking at percent of persons 65 or older living alone. This is data from 2015 to 19. I can click on this blue info button here and find out this data is at the county level, and it's from the US Census Bureau and the American Community Survey. So I'm going to go ahead and click that, and then presto, instantly we have this map for our indicator. And let's do a state zoom. Go in here and we'll highlight Ohio. And then we can also click this box, show state mask, and then it grays out the surrounding states and counties so we can really zero in right on Ohio. And again, the darker colored counties are the ones with the higher percentage of persons 65 or older living alone. And right here we've got Noble County. This has the highest rate, 21.99%. We can download this data set, or we can go up here. We have the ability to print a version of the map or save the image in a graphics file format so we can add it to different documents and presentations. Right, back to the PowerPoint slide and moving on to our third resource. This is a biggie. This is Rural Health Information Hub, or RHI Hub. RHI Hub is funded by the Federal Office of Rural Health Policy, and it's operated by the Center for Rural Health at the University of North Dakota School of Medicine and Health Sciences. It serves as a national clearinghouse on rural health issues, and there's an incredible amount of information on this site. You can find state and topical guides, interactive maps, county level data, case studies, toolkits, and opportunities for funding and collaborating with others. I'm going to bring up this homepage now. Maybe, there we go. Okay, move this over. And if you're like me, you might just want to start clicking on all these things here in the middle because everything looks so great, but everything you see down below can be accessed through the 5 tabs running across the top. So we're going to take a look at each one. On the far left is the online library, and the library includes over 12,000 resources. It's updated every day. You'll find links here for funding, national and state news, events announcements, featured publications, and then information about other government agencies, research organizations, and nonprofit groups that are interested in rural communities. The Topic and States tab contains over 50 topic guides, and they have guides for each U.S. state, territory, and commonwealth. The topic guides contain both an overview and a collection of the best resources on the given topic. The RHI Hub staff adds new resources continually throughout the year, and then they perform a complete review annually on every guide. So I can browse all the topics by bringing this up. We've got different collections here by subject matter. We can also browse the topics A to Z list. I'm going to click on C and then bring up critical access hospitals. So here's our overview section, and then that's followed by a list of frequently asked questions. And these really get into the nitty-gritty. Like you can see here, what is the Medicare Rural Hospital Flexibility Program and how is it related to CAH program? Can a CAH own another healthcare facility? I mean, they're not just the basic ones like what are the benefits of CAH status. So you will get a ton of information here. And once you've familiarized yourself with this overview content, you can take a look at the key resources. Let's see, I'll click on resources. You see here that we've got a couple of recent articles that were added this month. We've got this one on patient transfers to and from critical access hospitals during the pandemic. Then we've got funding and opportunities. This first one here, let's see, this is giving assistance for healthcare providers to cover expenses related to broadband connectivity. And that deadline is April 1st, so you still have time to apply for that one if you want to do that. Let's see, I am going to go back to the topic guides now, and I just want to show you one collection that is amazing under the how-to guides. These are all terrific, but this one, Finding Statistics and Data Related to Rural Health, is wonderful. Here's our overview section, followed by our nitty-gritty frequently asked questions. And then up at the top, we have our key resources. And I want to show you the data sources and tools. This is a table that would be great to bookmark. It's got different sources for data that's available, and it lets you know how easy they are to use, which is you don't often see that criteria reported on. They tell you the geographic level that the data is collected and how frequently these are updated. So this would be really great just to have on hand. All right, I'm going to show the state guides now. Of course, I'll click on Ohio and bring this up. These function just like the topic guides. You have an overview. Here we have a map with 2020 census data showing the metro and non-metro or rural areas in the state. And this estimates that 19.8% of the population was living in non-metro areas in 2020. Got a little map here of Ohio rural healthcare facilities. 33 critical access hospitals are showing up there. And then if we go up to our key resources, I'm going to click on the chart gallery. This is a collection of charts, graphs, and maps for the state, and we can narrow these by type or by topic. I'm going to click on topic, and then I'm going to select behavioral health workforce, hit OK. And this first chart that we have, health professional shortage areas in mental health providers. This is with 2022 data. So this data is coming from HRSA, and it's showing the counties where there's a shortage, either in different parts of the county or across the whole county. Butler County is one of the very few where there is no shortage area at all. The gray counties have parts of the county that is a shortage area, but unfortunately the majority of the counties in the state show the whole county is a shortage area. And let's see, since we're in data visualizations, I'm going to go ahead and click on that tab now. And again, this is where you'll find more charts, graphs, and maps. I'm going to click on Rural Data Explorer. And this is an interactive map that lets you drill down to county level data on different indicators. This is our pull down menu of all the indicators that are available to us. There's a lot on healthcare facilities, different demographics, as well as different disease conditions. I'm going to bring up diagnosed diabetes prevalence. And this is highlighting that 2017 is the most recent data that they've got available for this. This is coming from the CDC. And we see our national rates here for non-metro or rural areas is 12.8% for diagnosed diabetes. If we hover over Ohio, we see the non-metropolitan rural rate is 13.1%, so higher than the national average. And I can save and download this information, this image. I can share this URL of these results with others, and then I can download a CSV file of the data. Right, moving over to our next tab is case studies and conversations. And here we've got a collection of models and innovations. And this will let you review different rural health projects that other communities have undertaken. So you can learn a lot from what they've set in place. You'll also find links here for various newsletters, podcasts, webinars, and videos. RHI Hub has a nice feature where you can create a custom alert to receive notifications when content is added on a particular topic that you're interested in. And then our last tab is Tools for Success. And here's that tool that I referred to earlier, Am I Rural? You can use this to determine if your location is considered rural by those different definitions of rural and see if your location meets the eligibility criteria for various federal programs. So what do you think? What's Oxford? We'll type this in. Now, this is designed to work best if you have a specific point on the map. So the more exact your address is, the better. Here we have several different Oxford, Ohios that are around the state. I think this first one was the one that was in, yes, Butler County. So you can drag and drop this to any different area. We can just try going over here. Let's see. So we'll run this report. Let's see, we scroll down, we find that Butler County is 9.34% rural, This particular area is considered metropolitan. It's not a county that has been designated as a Federal Office of Rural Health Policy defined rural area. It doesn't meet frontier and remote area criteria. It has a RUCA code of 2, so that is not within that 4 and above that designates it as a rural area. Then we can see if we're eligible for different programs and if there's a shortage. So in this area, you're kind of out of luck for help. And I know that there's lots more definitions other than those 3 federal ones that we talked about. So clicking on help and then scrolling down towards the bottom, they give you information on all of those definitions that they're using so you can fully understand them. And then you have the ability to print and save this as a PDF too. So one other thing under tools and success are these evidence-based toolkits for rural community health. And these can help you with community programming. They have them broken down by different topics, so you can get ideas on what you might like to do. If you've never done any programming before, this Rural Community Health Gateway is a great place to start. It's going to walk you through step by step on how to identify an intervention, how to secure funding, how to create methods for evaluating and keeping your program sustainable, and then how to disseminate your results and share them with others. Okay, back to the PowerPoint slides. And here's our 4th resource. This is County Health Rankings and Roadmaps. And this is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. County Health Rankings and Roadmaps compiles and standardizes data from several sources and provides a snapshot of a community's health. It's just about time for the new annual rankings to come out. Those are usually shared in March, so you can keep an eye out for those. In addition to all those statistics and data that they share, this resource is really focused on action. So they want people to act on what they learn when they look at those statistics. And they offer a collection of strategies and evidence-based ideas for improving local community health. Here's our web page, and I am just going to jump right into searching. You can do it right here in this box, and you can either enter a county or a state. We'll bring up Ohio. And here we've got this green map that is showing. This is our health outcomes map for counties. And the health outcomes use 2 different measures, length of life and quality of life, to rank how healthy a county currently is compared to others. And the counties are ranked from 1 to however many number of counties there are in that state. In this case, there are 88. And 1 is the healthiest county. I can click on rankings here to see how this sorts. So the healthiest county in the state is Delaware. Toggle this. The least healthy county is Scioto. I hope I pronounced that correctly. I'm going to go back to the map now, and I'm going to pull out a second map that's available. And this is the blue health factors map. And this uses 4 different measures: health behaviors, clinical care, social and economic factors, and physical environment. And they use those to estimate the future health of each county. So it can be seen as a precursor to that green health outcomes map. And again, we have Delaware County as the healthiest. This time, Adams County is ranked 88th and the least healthy. So I can pull up Adams County and take a look at more data on that. Here, notice it says it's ranked 83 out of 88 counties. That's because it's also taking into account the health outcomes result. So here we see the quartile where the county falls according to those green health outcomes and blue health factors we were just looking at. We can download all this data here. If I scroll down, we can get some more information on the county demographics. Here we see that 24% of the population is under 18. We've got 18.7 over the age of 65, and 96.1% of the county is non-Hispanic white. Then down here, we can really get into exploring the different indicators. And you'll notice some of the indicators have a little graph icon. These track how the indicator is trending over time. So red means that the indicator has been getting worse over time. Yellow means it's been holding at the same rate. And if it's green, it means it's been improving. So you can click on those icons and that will take you to more details. We have this graph here showing the county trends, the state, and the national trends. And you can see that the county's been over the state and national averages for quite a few decades. We've got the definition of this indicator, so it's years of potential life lost before age 75. And then they break this down into the leading causes of death under age 75 in Adams County. So these give you an idea of where you might want to focus some efforts for the county. There are also a couple of health outcomes that aren't included in the rankings. This is usually because they don't have enough information for all of the counties to be able to rank that way, but you might want to take a look at these too. We've got COVID-19 information, frequent mental distress information. And then I also really like that you can click this box, show areas of strength. So these are indicators where the county is doing better than state or national averages. Even here where the indicator is trending worse over time, it's still doing better than state or national averages. So it brings a little positive information for that county too. And then the last thing to show you is here you can click compare counties. And then you have the ability to add different locations to do a direct side-by-side comparison. And you can select from peer counties throughout the whole country that have similar demographic, social, and economic indicators. So I'll just click on this first one. I could add another county that's in Ohio to take a look at. And then I could add a state or a national average. So then we have all those indicators that are showing up for side-by-side comparison. All right, we are on to our final resource now. And this is the Community Guide to Advance Health Information Equity. This is a little different. This is an interactive resource that NNLM Region 6 developed in 2016. And it uses county stories to facilitate awareness of health information needs. And you'll also find information on the importance of health equity, health literacy, and digital health literacy. So with this one, we've got this Get Started button here. You can click on that. And this takes you to the introduction and all that information on the why and how this guide was developed. You can click on any of these tabs across the top to get to different content, or you can just scroll down the page. There's information about medically underserved areas in the region, community health needs assessments, and then some background information on the importance of health literacy, information equity, and the digital divide. I'm scrolling a little fast down here. If I click on these 4 squares, I'll get back to the home page. And we currently have 63 county stories that are available. There are 9 in each state. And you can bring up the state story collections by clicking on one of the boxes. We'll click on Ohio. And I'm going to click on Adams County again. And again, with this, I can either click on one of the tabs here to get to information, or I can scroll down the page to navigate to content. And the different local media resources that are used, including photos, videos, and reports, really personalize the information for the county. And we've got CSV files from census data that have been transformed into different discoverable maps, and county health rankings and roadmap health reports have also been embedded. And you can use these county stories to explore why there's a barrier to healthcare services or information, and to identify community partners that you might want to engage with for health literacy and digital health literacy outreach. Got some maps too. So like I said, to date, we just have 63 counties done, but there are 623 counties in our whole region. So to address this, we are enabling some crowdsourcing functionality through the ArcGIS software that this resource is built on. And we've got a library information science graduate student who's lined up to do a practicum with us in 2 weeks. And he's going to help turn on the crowdsourcing functionality. And as soon as that's available, we're going to start asking our network members to share their stories and photos. So stay tuned for that. All right. Looks like we have 2 minutes left for questions. So we'll just fire away. I'll answer as many as I can if you have things about particular resources or just questions in general.
Do any of these sites have something like a conversation guide that can get members of the community talking about some of these issues? Not necessarily experts, but community members.
So was the question about finding like a talking guide? Is that what you meant?
Yes, discussion guides or community discussion guides to talk about sort of rural urban divides or health issues in rural communities, anything like that.
I would imagine that Rural Health Information Hub would have things like that with all of the programming information on there. I haven't specifically noticed that. I'll take a look and see if I can find that. But I know that they do have those step-by-step evidence-based guides. I would imagine that they would have things like that about talking with community members, how to get conversations going. That would be a good place to start for that type of information. I'm curious about what kind of needs you find in your daily work. What sort of things are you most looking for? Do you need statistics? Do you need patient education information? Where's the focus of your information needs?
As a librarian, I feel like most of my needs would be helping students find statistics and other research surrounding this, and less on patient education. But that's due to the nature of my specific job.
For us.
Yeah.
Classroom, providing them data. Serve.
I didn't quite hear all of that. Breaking up a little bit.
Just all of it.
All of it, student education leads to patient education.
I heard the patient education portion of that. What was the first part? I'm sorry.
It's talking about how we begin with like using statistics to teach the students about the population they're gonna work with, but also giving them the resources to provide patient education once they go out in their clinical.
Great. Yes. Okay.
On chat, Rhonda says, within the nursing department, these resources will assist students in their assignments and better understanding the health needs of the community. And she says, thank you so much for reviewing all the resources and links.
Great. You're welcome. Yeah, I'm glad that'll be helpful.
The departments that people were interested in this topic, I am going to build a page that we can add to your research guide so that you'll have quick access to it.
That's great. I can share the slide set too, so you'll have the links on information on these resources that were shared today.
Yeah, thank you. That's what I think, thank you.
I see I'm 2 minutes over the top of the hour, so I just want to thank everybody for attending today, and please feel free to reach out anytime if you have questions in the future. I'd be happy to help you.
Thank you. Thanks,
Thanks so much.
Yeah, you're so welcome.